Hello, my name is Tim, and I just wanted to share with you a few quick tips on how to get the most out of your medical appointment. Now, I know that there are a lot of changes in the healthcare system, and a lot of people have some different frustrations with that, but one thing that probably hasn't changed and has been about the same for a good period of time is that there's not a whole lot of time that you have with your medical provider in those medical appointments. You maybe get 15 minutes. Sometimes you can get a little bit more than that, just depending, but most of the time they're pretty short, and the medical provider has to get in there, deal with you as quickly as possible, give you the best recommendations, and then leave. So these are my tips for how to get the most out of that small period of time. So first, fill out the paperwork. I know it's a little bit of a hassle to do, but just fill out the paperwork, get it done. It will make it so much easier for the medical provider, number one, to get a good overview of your health, and number two, it gives you the opportunity to think about your medical history rather than being put on the spot right there in the medical appointment trying to think of all of the different things that have ever happened to you health-wise. Number two, write down your questions before you show up to that medical appointment. The main reason for that is because most of the time the medical provider is going to ask you lots of questions about things that are totally unrelated to what you think the main problem is when you come in. So make sure to write down your questions so that you don't forget what it was that you came to ask in the first place. Three, be really honest with your medical provider. We all have different embarrassing medical things happen from time to time. Just be honest about it and what's going on for you. Also, explain if you're taking over-the-counter supplements or vitamins or minerals. Your medical provider needs to know that to be able to look at medication interactions and your overall health and your health conditions. And also be really honest about your alcohol use, drug use, things like that, sexuality as well, because that's all really important for figuring out what's going on with you, and so that the medical provider can check for interactions. And also, if you do have a problem with substance use, your medical provider can be a good starting resource for how to get help. Four is stay on topic. I know that we all like to get to chatting about different things with our medical providers, especially if they're a reasonably likable person, which many of them are. We want to get to talking about other sorts of things. So if the more that you can come back to the main topic at hand, sure, a little bit of small talk is fine at the beginning, but try to stay on topic and use all of your time for what you need it for. And the fifth is don't get too offended by things that your medical provider suggests to you. There are always going to be some things that we're a little bit touchy on, as far as, oh, maybe you need to lose a little bit of weight, or maybe you need to cut back on how much you're drinking. Have you thought about quitting smoking? These are really common things, and they're hard for us to deal with, or like, maybe you should cut back on some of that junk food. None of us want to hear it, but that's what the medical provider is there for, is to give you the best recommendations for improving your physical health. So just listen to what they have to say and think about it. We're all on a journey in regards to our health, so don't get too offended by it. And also, if you're asking for a particular type of medication, that's fine to say, oh, I heard about this, what about that, for my particular problem. That's okay, but don't get too offended if your medical provider says, no, that's probably not the best choice for you, because all medications have risks and benefits, and your medical provider went through a lot of school and training to make sure that they're giving you the best recommendations for your medical treatment. I hope that this helped, and I hope that you get the most out of your next medical appointment. Thanks. Have a great day. Bye.